Hello, mommies and daddies. This is OT Cesar, your pediatric occupational therapist, online playmate, and your chief growth officer. As we celebrate World Speech Therapy Day, we have invited a very special guest. She is Teacher Kaye of Teacher Kaye Talks, and she will share with us about her work as a speech language pathologist. SLPs are vital allied health professionals who work alongside occupational therapists, and you will most likely encounter one in your child's growth journey. We have listened, and today she is here to answer your most frequently asked questions about speech therapy.
Hi, I'm Teacher Kaye from Teacher Kaye Talks. Thank you, OT Cesar, for having me. I'm going to try to answer frequently asked questions about SLP. So number one, what is SLP and how can an SLP help my child? SLP stands for Speech Language Pathologist, and I'm a certified speech language pathologist, or more commonly known as a speech therapist. As the name suggests, speech and language po yung specialty namin. And a lot of people think that speech and language mean the same thing, but they're not actually the same thing. Language is the entirety of all communication systems, so that includes the way that we communicate with gestures, with our body language, written communication, and our spoken communication. And speech talks about the sounds that we produce in spoken communication. So speech therapists help people who are having troubles with any forms of their communication. But that's not all, there's more. We also need to address problems that are related to speech and language. So that includes feeding and swallowing, kasi gamit nila ang same muscles. We also have to address hearing issues, breathing issues, kasi nakakagawa tayo ng sounds and words with our breath. In children, the most common cases that we handle include communication delays or disorders. So we can usually see these as early as, let's say, if at 3 months, hindi pa nagkuku yung baby, or by 6 months, wala pa silang sounds na ginagawa like babbling, or by 1 year old, wala pa silang one word, or by 2 years old, hindi pa sila nagko-combine ng 2 words together, or by 5 years old, marami nang sinasabi yung bata, pero hindi siya maintindihan, medyo may pagkabulol. Speech language pathologists help people who have trouble understanding or expressing themselves through communication. In adults, we help people who lose their ability to communicate, for example, mga post-stroke patients or mga nagka-traumatic brain injury. So when something happens that affects their language parts of their brain. Question number 2. I'm having a hard time finding an SLP in my area. While waiting for an appointment, how can I start working on speech or language therapy goals at home? Why, thank you for asking, because my YouTube channel is dedicated specifically for that. I give tips on how you can stimulate language at home, whether because nag-aantay kayo ng appointment or wala talagang SP dyan sa area ninyo, or nahihirapan pa kayo sa financial aspect of getting therapy. But if I may give my top 3 tips at the moment, if you notice that your child has some sort of communication delay or talagang may difficulties siya with trying to talk or express him or herself, my first tip is really to follow the regulations from the medical standpoint about gadget and screen time. So this says that babies from 0 to 2 years old should not be exposed to any sort of screens at all. And this is based on research. I have a full episode on this, but very shortcut version is that babies' brains are not ready to handle the stimulation from screens, especially hyperstimulating videos. So that includes watching cartoons or anything with animation. Now, what about babies older than 2 years old? They also say that children up to 5 years old should only have supervised screen time and no more than 45 minutes to an hour for a whole day, not one sitting. From my personal experience, I've had so many clients who came to me thinking that their child was delayed developmentally, and they were thinking the worst, baka meron siyang diagnosis na hindi namin pa alam. And it turns out that the delays were really just caused by overstimulation by screen time. My second tip And it may sound obvious, but always talk to your child. I have had parents who didn't know that they could speak to their babies already because they were thinking na infants pa naman yan, hindi pa naman nila ako naiintindihan. But that's where it starts. The way that we talk to each other in the vicinity of the baby or the way that we talk to the baby already gives the baby the idea of, oh, those are words. Oh, that's how you use those words. So keep talking to the baby, whether it is about what the baby is doing or what you are doing at the moment and baby is watching you. Just to give you an example of this, for example, you gave baby a rattle and baby keeps holding it and shaking it. In this time where baby is doing this, you can just keep talking and saying, shake, 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 rattle, holding rattle. Ooh, rattle makes sounds. Wow, shake, 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 rattle. You can also do this. For example, iniwan mo si baby sa crib, pero alam mong habang nasa kusina ka, nakikita ka ni baby, pinapanood ka, nagluluto ka. So you can also talk about what you're doing para nakikita ni baby, yan pala yung ginagawa ni mama. Sabi ni mama, I have a carrot, meron akong carrot, icha-chop ko na to with a knife, chop, chop, chop. Anong sound? Tak, tak, tak. Wow, yun ang sound ng chopping carrots. And my third tip is to avoid over-serving your children. What does this mean? So sometimes kasi sa sobrang pagkakaintindi natin sa baby natin, we are so connected with them na titingin pa lang sila sa isang object, alam mo nang gusto nilang kunin or abutin yung car, toy car nila. So ibibigay mo na sa kanya dahil tiningnan na niya. But that kind of gives them the idea na, oh, titingnan ko lang pala, makukuha ko na yung gusto ko. So you're not giving them the maximum opportunities to ask and request by using gestures or by saying things like give or car. So you may want to watch out for how you behave in these communication situations. But also, if you're having trouble finding an SLP in your area, please just message me. And I have been trying to help match families with therapists, whether teletherapy yan or online therapy or some centers in their area. Question number 3. My child can already say and imitate some words, and we have an OT who works on their language goals as well. So why would I need an SLP? So you're right that there's some sort of overlap between occupational therapists and speech therapists because hindi nga naman may iwasan ng OT to use verbal instructions or gestural instructions para magkaintindihan sila nung pasyente nila. The difference, I think, lies in that our specialty is speech and language, so every single task and problem has little micro steps in them. We know how to task analyze saan ba talaga nanggagaling yung communication problems ng bata. So it's really not just as simple as, ay, hindi niya kasi ako naiintindihan, teacher, period. Pero bakit hindi ka niya naiintindihan? So it is our job to figure out, does it start with the hearing component? Or is it because nahihirapan siyang mag-process ng auditory information? And the problems with speech, the very vague problem is hindi po siya nakakasalita. But could it be a word retrieval problem? Is it because hindi enough yung vocabulary niya? Or is there a problem with the motor component of speech, meaning yung muscles niya hindi pala ma-coordinate kung paano sabihin ang word kahit na alam pala niya yung word na yon? So in short, it is in the analysis of the problem and making goals and creating specialized programs for the child that differentiates us from occupational therapists. Question number 4. How can I determine if my child has a speech delay or if his speech development follows his own time frame but still within normal boundaries? So I talked about milestones a little bit earlier, and the thing about milestones is it is a guide, but this guide is actually very giving, very relaxed kasi yung mga ranges in a milestone are already pretty broad. For example, for a 1-year-old, we expect that they have at least a single word utterance na or nakakasabi na ng iisang salita. But a 1-year-old can also have around 10 spoken words already. So ang laki ng 1 word to 10 words. So if the child does not exhibit the minimum requirement of that milestone, then we should already seek for help. Because the development of skills from 0 to 3 years old, sobrang bilis po niyan. So kung hindi tayo mag-seek help in the earliest time, if we keep waiting and we keep waiting, palaki ng palaki yung mga dapat alam na ng bata at lagi tayong maghahabulan. Imbis na sa maaga pa lang, nakaseek na tayo ng help, so we've already helped the child earlier on. Therapy is actually just giving the child the tools to learn on their own. And the last question, is there anything that I want to discuss? Related to my response in question number 4, do not wait and see. If you notice that your child has any communication difficulties, nahuhuli yung ibang skills niya sa mga expected sa milestones, seek help already. There is no shame in your child having a speech delay. Hindi po ito brand, hindi po ito tatak na, yung bata, speech delayed. Speech delay just means that they are journeying a little bit slower than other children. So let's help them catch up. Communication is so important to the quality of life at every stage of life. Whether it is showing affection by having eye contact with you, or imitating the words that you are saying to them, or learning how to ask for things, lahat ito importante. And as early as possible, we want the children to have access to all of these skills. That will make life better. So thanks again for having me, OT Cesar. If you have any questions about speech therapy or speech language pathologists, please go to my YouTube channel, Teacher Kaye Talks. It is the same with Facebook and Instagram at Teacher Kaye Talks. Happy talking and mabuhay!
Thank you, Teacher Kaye, and happy World Speech Therapy Day. It takes a village to grow a child, so we thank you for being part of the Growth Village.